Hello, welcome to How to Write a Good Research Paper, Episode 5, The Do's and the Don'ts. My name is Dr. Maneerat Chayanupatkul from the Department of Physiology, Faculty of Medicine, Chulalongkorn University. So this is the outline of this talk. I'm going to talk about how to write a good research paper, the do's and the don'ts. We will start out with what you should do before you start writing a research paper. And then I will go into detail about the do's and the don'ts of each section of a research paper. So first off, what you should do before you start writing. Of course, writing a research paper is like writing a story. A good writer will not just write whatever you come up with in your mind. You will start with outlining what you want to write in each section in your research paper. It's like a good writer writing the beginning of the story, the climax, and the end. The same thing, same concept. So you have to outline what you want to write. You might write it down or you outright it in your mind if you have done it often enough. Again, don't just go with the flow. Don't just write whatever that comes up at the moment and write it, because in the end, it will be like a mumble jumble jump around of the ideas. And it's not a good kind of research paper. So what are the sections that I included in a research paper? That include titles, abstract, introductions, materials and methods, result, discussion, / conclusion, and references. I will go into detail of the do's and the don'ts of each sections. So first one is the title. So the title is what actually catch everybody's eyes, the reviewers, the reader. So what you want to put it there is to anything that will catch the attention of someone else, reviewers, readers. And what you should do about the title, you should write a clear and concise title that summarize the gist of your research. You don't write like 100-word titles because people's attention will stop at like 10 words already. So summarize your research in a very concise way in your title. If your research has something new and interesting, put it there as well, because that will catch everyone's attention. And of course, avoid abbreviations in your title, especially the non-standardized abbreviation. And also the don't is that don't misrepresent or over-represent your research. Or in other words, don't exaggerate your result in the title. For example, if you study a medicine that treats fatty liver disease, your results show that it improves fatty liver, maybe a little bit better than a placebo, but not like a very stellar result. Don't put the title like curative effect of this so-and-so medication, because that is the exaggeration of the result. And when the people actually come and read the abstract and the article, they found out this is nothing like what you said in the title. And you kind of make it the whole thing unreliable. So don't lie about what it is in your research by exaggerating it in the titles. And next is the introduction. So in the introduction is what gives you, the readers, the background of the conditions or the disease that you're studying, and then go into why you're doing the research. So the do in the introduction is that you should keep some, but not too much, some background and magnitude of the disease and the condition that you're studying, why this disease and conditions are important that you should study. For example, I want to study about fatty liver disease. I put a little bit of maybe prevalence of the disease, the outcome of disease like leads to cirrhosis, cancer, death, and then you put in the summarize what study that have been done before. And then you provide a knowledge gap, like, okay, we know about this and we don't know yet about this. And then you put in your research objectives in that gap. And you said why it is important that you're doing this study, because you want to fill in this particular gap in this condition. It's important to keep it concise. Introduction shouldn't be longer than 1 page. Nobody wants to read 2 pages introductions. I will throw it away myself if I see 2 pages introductions. Of course, the don't is that don't write irrelevant information. in your introduction. For example, you're studying the treatment of fatty liver disease. You don't have to put, for example, clinical presentation of fatty liver disease, blood tests, imaging study, pathology, because that is not relevant to what your study is. Don't include those information in the introduction. Second, you should review a little bit of previous data, but summarize it. Don't put in details like, oh, this person so-and-so compare this and this, the number is this, the number is this. That's too detailed. That you can put in a discussion, but not in the introduction. In the introduction, you just summarize. Okay, this study have done this and found that, and that's it. Don't put in numbers, data, and details about the research. That you keep it in the discussion. Next, the materials and methods. This section provides leaders to understand how we conduct our research. So the do is that sometimes our results are so interesting that some other people want to repeat the study to look at other aspects of the disease. So you should provide enough information about your methodology for other researchers to repeat the study if they want to. Not too vague and also not too detailed. What should you include in the material and method section? That is one, study population, sample size and the sample size calculation, inclusion and exclusion criteria, randomization method if the study is a randomized controlled trial. Data collection, which include how you collect the data before, after the study, what kind of data you are looking at blood tests, imaging, pathology, what kind of blood tests, those kind of things. And also the appropriate use of statistical analysis, you have to detail. For example, you want to compare the numerical data, you use student t-test before and after, you use paired t-test for a non-categorical variables, you use this and that. So use appropriate statistical analysis and you put that in your method as well. The don't is that don't include anything that doesn't answer your questions. For example, you're doing a study on a treatment effect of a medication on fatty liver disease. You don't have to include like clinical presentation of the patients or any other material and method that doesn't answer your question because it's irrelevant. Again, don't put any irrelevant information in your paper. For the result, the do for the result, you should present your result in the orderly fashion. You may do it by subsection your result or divide it into different paragraphs of each result. For example, so you're doing a clinical study, you start with the epidemiology of the study, you follow by, for example, the blood test, before you give the medication, after you use the medications, maybe in terms of long-term outcome afterward. So put it in different sections so that it's easy to follow with the result. You should also use tables or figures, especially if you want to compare 2 or 3 groups, is give you a better visualizations of what happening between the 2 groups with the tables and the figures. Again, don't include any irrelevant information that doesn't answer your research questions. And also, if you already provide the details information in the tables, don't repeat all of that in the text. For example, in the table, you have the demographic data between the group A and group B. You have age, mean age A and B, gender, initial blood test, so and so. We have number, we have p-value. Don't repeat all of those information in the narrative. You just summarize that, okay, in the before the start of the study, demographic data show that age is different or nothing is different, and that's it. And everything else you refer to the tables, and reader will look at the table and they don't have to read this and also look at the table and say, well, they look the same. Okay, you don't need to repeat the information. And then we are ending with the discussion and the conclusion. What's the do for the discussion? So you should first explain, like summarize a little bit of your finding and explain it. For example, you found that the this medication reduce the inflammatory markers of the liver, and we try to explain why this medication reduce inflammation by which mechanism. And then you use those findings to support your conclusion. For example, if your conclusion is that this medication helped with fatty liver, you use your finding and said why this mean that it reduce liver inflammation in fatty liver. And you should also compare your result with previous research. For example, okay, we found that this medication reduced liver inflammation is inconsistent with a research done by Mr. So-and-so who compared this medication with something else, and they found that this reduced inflammation. Or you can use other research that actually have different results from your research. Or you can say, in contrast, this study shows so and so. If the results are different, you should also discuss why you think it's different. Is it methodology? Is it a dose of the medication? Is there other factors? And those other should be included in the discussion. Like what's new in your research, because that's what will get you published. So you want to tell what is so interesting and what's so new about your study. And usually before the last paragraph, you briefly mention the limitation of your study. Briefly, just say, okay, limitation of study may be the sample size, the loss of follow-up, or whatever. And then you end it with the area for future research, like, okay, we think this medication work in worst way, and what we should do in the next step. We can study with a longer follow-up. We can look at the long-term outcome of this medication, or look into exact mechanism of medications, those kind of things. What you shouldn't do with the discussion is to repeat the whole result in discussion. This is a very common mistake that people make when they're doing a discussion. They just put in the result all over again in the discussion, usually 1 or 2 paragraphs. Don't do that, because they will read that in the result section. You just summarize it, like instead of saying, okay, medication A reduced ALT by so-and-so percent or so-and-so number compared to placebo, which decreased this and this number. This is too much. You just summarize that, okay, this medication reduced inflammatory marker, which is ALT, in patient with liver disease, for example. Second, you can put limitations of your study, but don't scrutinize your result. Don't say, oh, our study is terrible, we have small samples, we cannot conclude anything. This is exaggerated, but don't try to scrutinize your result. Other than that, it will make your result unreliable. And then they was like, okay, why bother if you think your result is not perfect? So you can put a little bit of limitation, but try to kind of support your data in a way. Don't make it worse. And then you end with the references. The dues for the references is that you should use references from reliable sources, like from articles that are cited in Scopus, PubMed, or standard textbook. And you should use up-to-date references. For example, you have 2 papers that study the same thing. You should cite the more up-to-date one, like the one from 2021. Instead of citing the one from 1990, because the more update have better in terms of methodology and whatnot. If both are published in a very good paper, you should use more updated data. And also, each journal have their own guideline about what kind of style of reference they want you to write. So make sure you read the author guidelines of each journal carefully and adjust the reference according to that guideline. So in my opinion, it's better to use a reference tool such as EndNote, because if, for example, you submit this paper, you got rejected, and the next journal use completely different style, you can just click change the style and everything will change to according to the journal guideline. And the don't is that avoid website references, with the exception of certain reliable web resources. What I don't want to see reference from Wikipedia, Sanuk.com, not even up to date. If you want to cite from up to date, look what kind of reference up to date use and go back to the primary reference and use that paper. Don't cite up to date in your research paper. That usually not acceptable. The example of web reference that you can use, usually the one that provide very reliable resources and you cannot find it in research articles like CDC, WHO, or some society guideline that publish the guideline on the online only kind of website. In that case, you can cite as a web references, but other than that, you should avoid web references. Also, before you cite it, make sure you actually read that references. Some people have a habit of citing from a review articles. The problem is, for example, I read this review article and they say the epidemiology of fatty liver disease is so and so, and you cite that paper. It's not always the right thing to do. You should read what the reference that this paper used in their reviews. Sometimes they even cite another review articles, and that review article cite another review articles. So it's best to go to the primary source of the reference, the actual study that look at the epidemiology, like maybe some multi-center studies or some global study, and you use that primary reference. Because sometimes as you play the game that people talk from one person to another, in the end, the information changes from the first person to the 10th person. So don't try to avoid citing from the review article, cite from the original primary source of the information. Again, and also if you want to cite something, make sure you read it because sometimes I found some mistake that people actually didn't read the reference they cite, and the information in the reference are actually different from the information they put in a research paper, and that is actually bad when it happens. The last thing will be about the general rules of the do's and the don't. The do is that after you finish writing everything, proofread the whole manuscript at least twice to look for any typos or grammatical errors, because for a research paper, typos and grammatical errors are unacceptable. It says something about you, that you are not careful enough or you don't care enough or something along those lines. So don't make this mistake at least twice, but actually do more than twice even. And also, if you don't feel comfortable with your English or your writing, ask someone else who's proficient in English to read it and correct your manuscript. Or you can also use language services. Our faculty have English language services that can help you. Some journal also provide language services for a non-English speaking author. So you can use that kind of service if you think your writing skill are not perfect yet. The number one don't for the general rule is plagiarism. Don't plagiarize, don't copy and paste other people's articles or even from online resources in your articles. Nowadays, almost every journal, have their plagiarism tool. So they will check the plagiarism in your research paper. So if you actually plagiarize other people, they will send it back to you and say, okay, you need to rewrite the whole thing. So avoid doing that in your research paper. Second, this is a common mistake of Thai people. It's okay to repeat the same word from time to time. You don't have to put this word into thesaurus and try to use different word every time for the whole manuscript, because in the end, since you're not an English speaker, you might use some fancy words that are not correct in meaning. For example, if you put demonstrate in a thesaurus, you might get demonstrate, show, illustrate, but demonstrate and illustrate are not the same thing. Illustrate in meaning you're trying to show it with pictures, graphs, something with kind of visuals, but demonstrate is not the same. So you cannot actually use illustrate if you just want to show it with word. So that are not the same meaning. So make sure whatever word you use in your paper, you actually know what it means. Don't just use something because it looks fancy, because it might sound kind of weird for English speakers to read your paper. Also, the second most common mistake that Thai people make because we think the longer is the better. That is actually not always true. This means two things. Your research paper should be within the word limit of the journal articles, and also writing a long paper with too many irrelevant information are not actually good. So make it concise and understandable, easier to read in an orderly fashion. Those are better than writing long articles and actually mean nothing. Also, don't put too many sentences into one sentence. For example, don't put 3 sentences into one sentence, because in the end, we might make mistake with the grammars and other things, and that sentence might make no sense to other people. If you have to write like 3 sentences in one, just divide it in a smaller sentence. And maybe you can use a little bit of adjunction in the font just to make it flow better, but don't combine like 3 or 4 sentences into one, because in the end it's actually really make no sense. Because we are not English speakers, or we are not very good at grammar all the times, and when we try to combine a lot of information in one sentence, it ends up being nonsense. So those are the very common mistakes that most people make with the writing a research paper. So that will conclude this episode 5. So now you know how to write a very good paper, the do's and the don'ts. If you have any questions, you can write me an email at maneerat_ch@hotmail.com. Thank you. Hope you enjoy it.